guys, welcome back to Medical Coding with Blue. Today's episode is all about some cost-saving tips and resources for learning medical billing and coding in 2023. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I typically get this kind of question towards this time of year every single year of Blue, I am going to be taking my test in the next year. Should I get the current year books to study with, or should I get the next year books to study with? So here we go. All right, so I will start off by saying this. If you are planning on studying right now in the month of November, right? Or maybe you started in, you kind of like petered around and you started in October, but you haven't gotten your coding books yet, and you're wondering this very question, what I would recommend is actually getting the 2023 editions to learn on, only because they are quite a bit cheaper than getting the newer versions, which will be on sale, or you'll be able to find them cheaper next year, especially if you're planning to take your test in the fall. So around August, September time, that's when the book prices start to drop. They actually start to drop a little bit sooner than that, but it's just that's really the prime time when they start trying to get rid of all the current year books, and they start to get the new year books in, because the code and the code sets are updated for ICD-10-CM in October 1. Those codes change. So that's just something that you have to know. But just to learn on, just to get your feet going, I do recommend getting the current year. We're in 2023. If you see this in perpetuity and just whatever year it is, that's the year set of books that you want to get, because it makes more sense to get something that is, they're already, the code set has been updated, but you can always get the next year code set closer to time when you're about to test. So this way, if you have the current year books, which is going to be the older versions, right? It's going to be okay, because you'll be able to learn on those, all right? And the code sets, yes, again, they do update, but it's not going to be a radical change. It's not like when the time where we went from ICD-9 to ICD-10, then obviously, yes, you'd have to get something updated. But in this case, no. There's still a lot of the same things. And you can always listen to the guidelines for free, or you can read the current year coding guidelines for free, because CMS always puts those out, and it's a downloadable PDF. You can take it to wherever you make your copies and have them printed out for you if you want to do that. So that way you have the current year version of the guidelines to read, even though you are working with, like in this case, the 2023 editions. You can always be listening and reading the 2024 ICD-10-CM coding guidelines, because those are the most updated, okay? I've talked before about how you can listen to those, but I really do recommend reading them, because reading will make you much faster at processing information. And if you tell me, well, Blue, I'm a slow reader, that's part of your exercise to get faster, is doing the reading. And reading those coding guidelines is key. Doesn't matter where in your study you are, reading the coding guidelines is very important to start incorporating at any time, okay? Whether you're just starting the program, or whether you are finishing the program and you never did that, and now you're going to be studying for your exam, you need to be on those coding guidelines, because the coding guidelines are going to help you to understand what to code first, and what are the rules when, coding sepsis and all kinds of things. So there's a lot of really good information in there. There's too many new medical coders out there, too many new students out there that are not being told the importance of reading those coding guidelines. No one can do that but you. You have to be the one to read the guidelines yourself. You cannot farm this out. You cannot pay for this, for anybody, to do it for you. You have to do it. And it's part of the conditioning process, guys. Is it a lot? Absolutely. Are you going to read slow at first? Yeah, absolutely. But the more you stay on it, the more consistent you are, the better off you'll get. And do not try to make it make sense, because it will not make sense, okay? I'm just saying that. Just read them so that you're conditioning your mind to become familiar with wherever, you need to go in the guidelines, especially when you're taking the test. Okay, so that's just my little bit of advice there anyway. Now, everybody knows how much I love Optum. Okay, now Optum is a organization that they have a lot of books, right? And books for coding, the coding manuals, and they also have coding supportive books that I love. Again, this is not an ad. But if you go to optumcoding.com right now, like this year in 2023, you can get the 2023 editions for 80% off. Okay, this is just right now. Okay, I do not get any kind of incentive for telling you all this information. I give you all this information because it is helpful for coders. I do not benefit from this. Okay, but what I like to do is I like to make sure that coders are set up for success. Yes, there are some organizations that, when you're taking their course, they give you the books. But if you are independently studying, or maybe the books that you're getting from your program are not as helpful, right? They're not as user-friendly. These are excellent. They are excellent. And I always recommend these. Optum is the one that I trust. I love, I adore. But I want you guys to listen to this, okay? Cost saving. For all of you that are saying, well, I don't have money and this and that, and I really want to learn. And okay, guys, listen to this. The ICD-10-CM Expert for Physicians, right now, the 2023 edition is $22.99. The HCPCS Expert, right? $20.99. The Current Procedural Coding Expert, which is not the book that you can use to take your exam with, okay? You cannot use this book, but what you can do is learn from it because it has the same CPT codes as the AMA version. Right now, you're just trying to learn how to use CPT. So you can use Optum's version, right? It just has more information in it. That's the only difference between this and the AMA version that you do need for the exam, okay? So the Current Procedural Coding Expert is $21.79. If you get the AMA 2023 edition, even right now, it's like $136, okay, for the 2023 edition. And we're November 18th. So there's not much of there's no like really significant savings there, okay? But again, if you are on a tight budget and you just need to learn coding, these are the books that can help you to start getting there. These are the manuals that you need, right? These are the manuals that you need. Now, the total for those 3 books, and these 3 are the ones that you need to study with if you are studying for the CPC or the CCSP, okay? Both of these are your outpatient coding credentials, all right? Either one, different organizations, but they're both outpatient focused. And those would be the 3 that you need to study with, okay? Again, you cannot use the Current Procedural Coding Expert, okay, to take those tests, just saying, okay? But the total for those 3 books comes out to $65.77. $65.77 for the 3 manuals that you need, and there is free shipping on that. I'm just saying, okay, guys, you can afford this, okay? And find a way, guys. If you are having to pay out of pocket, find a way, all right? Now, the other book that I recommend that is low cost, right, to help you, and especially because everybody starts whining and complaining about E&M, all right? E&M is not as scary as y'all think it is, all right? Whoever you're listening to, stop listening to them because they clearly don't know. The Evaluation and Management Coding Advisor, right, is $25.99. And that's for the 2023 edition. I do recommend getting that because it is a workbook. It does have the answers. It does have the rationale. And it breaks down all of evaluation and management. Now, on my Patreon channel in January, I'm going to be starting an E&M class based on this book. So if you are in my Patreon group, it is $10 per month. You do not have to subscribe past a month, but if you do subscribe, the pledge members that are at the $10 and above level, they will be invited to this class. I don't have the particulars right now, as I'm still putting it together, but it will be based on this book. So if you want to attend, that's the book that you will need because that's the book we will be going over. So, but that's a way to help you to understand evaluation and management, okay? So for those 4 books, right, that's $91.76 altogether, okay? because the Evaluation and Management Coding Advisor is $25.99. Okay, so that plus the $65.77 comes out to $91.76. Now, if you are planning on taking the CCA or the CCS, you will have to add on the ICD-10 PCS coding manual, and that is $22.99 for the spiral version. You want the spiral bound one, because the spiral bound one is the one that has Appendix M in the back, like M like Mary. And in the back, it has a list of 388 procedures to look up for ICD-10 PCS. That's also part of your independent study. Going through all of those so that way you can be very proficient with that book. That will make you proficient with that book. Trust me, because that's what I had to do when I was studying for my CCS exam myself, that I successfully passed. I'm just saying. So that's the thing that you all need to know. If you're going to do that, the CCA or the CCS, that $22.99 added to the E&M Coding Advisor, the ICD-10-CM Expert for Physicians, the HCPCS, and the Current Procedural Coding Expert, the grand total for all of those 5 books is $114.75. And you have all of the books that you need, your coding manuals to learn from, right? Now, the workbooks that I recommend, the links are in the description box below, which is the ICD-10-CM and ICD-10 PCS Coding Handbook with the answers that will teach you both ICD-10-CM and ICD-10 PCS. But if you are only taking one of the outpatient exams, the CCSP or the CPC, you just need to focus on the ICD-10-CM coverage in that book. And it has the answers. Now, you can find this book, but it is a little costly. The one that I saw for 2023 is $163.47. That was the cheapest I could find it, and that was on abebooks.com, abebooks.com. And there's tons of book vendors out there. This is not an ad for them, obviously, Abe Books. But there's plenty of places where you can find books. You just have to be willing to look. But you want to get that ICD-10-CM and ICD-10 PCS Coding Handbook with the answers by Nellie Leon Chizen with the answers. You do not want to get the one that is without the answers, because how will you know if you're doing it correctly or not? So don't waste your time, don't waste your money, okay? Even though you may see it for like $5 or $6 or $10, it's worth it to look for the one with the answers. Now, can you work with old books? Yes, you can work with older workbooks. That's totally fine. You may notice that some of those answers are not going to match what's in your current book. You may see that they say that this is the answer, and that code is not in your book at all. That means that code has been updated, okay? And in that case, you can kind of like put 2 and 2 together and just sort of figure it out from there, because it'll tell you what that code equals out to, like the name, the title of that code. And so you can look in your book to see something similar, all right? You can work with older books. I've seen up to 2018. That is literally as far back as I would recommend. Anything further back than that, it's getting too old, okay? Because there's been so many updates and so many changes, and a lot of that stuff may not still be relevant, okay? So if you find the ICD-10-CM and ICD-10 PCS Coding Handbook with the answers, the 2018 version, that's about as far back as you'll want to go, okay? Now, the CPC Study Guide is the other one that I recommend to learn CPT. Now, that one, you can use it even if you're taking an HEMA exam. Even though it says CPC, it's okay if you're taking the CCSP, the CCA, or the CCS, because we all use the same CPT code set. So the CPC Study Guide is just broken down extremely well. I love the way that AAPC did it. They did a fantastic job. I don't give them credit for it, even though I'm all the way with the HEMA. I will give them credit because, again, my whole thing is so that coders have good tools, okay? That's a good book. It's written very well. There's very few of those codes that I disagree with. The selection of the codes that I disagree with. But overall, it's a very good book. It's got a lot of good points in it, and it breaks everything down very simply, okay? A lot of these programs will use books like Bucks. I do not recommend Bucks. I do not like Bucks. I have the Bucks books, okay, in my collection of books. I do not like the way that it is written. I do not like the structure of those books because I feel like they're written for people who have knowledge already of coding. That's just my own personal opinion. You may disagree, and it's fine. We can agree to disagree. You don't have to comment. Save your comment, really, because at the end of the day, I do these videos to help all of you, okay? There's been a lot of ungratefulness lately, and I'll talk about that here in a minute. But I do these videos in my time, in my energy, and my resources, and the things that I find. And I do this to help people. My videos have helped countless people pass their coding exams, to get back on track with studying, and now they tell me they have careers. My videos are used by schools and colleges like DeVry, not an ad for DeVry, but they do use my videos for their classes. I've been told several times, okay? So there's a lot of good that comes out of my videos. There's a lot of information that's covered in my videos too. So if you think that there's something that's not covered, trust me, if you look through those 1,100 videos that I've been doing since 2018, you'll see what's out there, okay? So with that being said, the other resources that I recommend that will help you on your journey and to get you the resources to help you learn, you can go to the public library. You can check out any book that you want to about medical terminology, anatomy, and physiology, pathophysiology. You can check out any one, guys, because medical terminology, anatomy, pathophysiology, and physiology have not changed. It has not changed. We're not discovering any new body parts, okay? Especially when it comes to learning the basics. There's plenty at the public library, okay? There's also plenty on YouTube. There's tons of fantastic channels. Crash Course is my favorite and most number one channel that I will go to look for those kinds of things. Hank is wonderful. Anatomy, physiology, medical terminology, there is all there, okay? You can do a simple YouTube search and it will bring up tons of videos about medical terminology or anything that you want to. Again, you could go to the public library and check out those books for free, okay? And you can find workbooks there on medical terminology. And I come from a very small town, and even when I go to my public library, there are still workbooks for medical terminology, for anatomy, and all kinds of things. You can go on Amazon, and I have the links for my Amazon recommendations in the description box below. You certainly do not have to click on any of those, guys. I've never tried to force y'all to do that, okay? It's there because people will ask me for it, and it's there. You can search Amazon on your own for all kinds of things, all kinds of workbooks or whatever you want to for any of those topics, all right? Because again, it's all the same. And even if it says it's for nurses or for technicians or whatever, it can still apply to you because you can still learn it because we all use the same language, okay? There is not a specific set of words that is only pertinent to medical coders. I've seen that. It's so stupid. It is so stupid because people will say, well, what specifically do I need to learn for medical coding? Everything, because we have to know what doctors know while never having gone to medical school. There's not a single doctor out there or PA or nurse practitioner that will say, oh, I can't use this word because the coders won't know what it is. Really? So I'm just saying. So visit your public library. Again, and you can Google anything that you are interested in finding out. Also at the public library, you can find medical billing and reimbursement books, okay? If you go online as well, you can check out the Medicare Learning Network. The Medicare Learning Network will tell you a lot of things that you need to know about reimbursement. You can simply Google APCs and DRGs and all that good stuff. You can Google all of those specific things and articles will come up. You do not have to have a specific book, Okay. Now, I do have the book that I recommend, Law, Liability, and Ethics, because it's got everything in it. And that, again, is in the description box below. But it makes everything a one-stop shop. You certainly do not have to get that specific book. You can get any book that you want to. You can go to the public library and see if they have something similar, okay? Or even if they have that title, you know. There's a lot of options, and especially for my folks that are in bigger cities, they get a lot of new books every single year. You know, that's always an option for you, all right? If you work at the hospital right now, you may want to consider looking at your medical library, okay? Because I know they allow employees to check out books or go to the library that's there. So if there's a medical library at your facility that you're working at, maybe you are doing prior authorizations, or maybe you're doing billing or something like that. You're already working in a hospital. Check out their medical library, so that way you could see whatever they have there, because you'll be surprised, because even at my facility, they had books, they had exam prep books for medical coding. And so I was like, wow, you know. And so I even was asked by the librarian to help order the new books, because he was like, I don't know about this topic, and you're a coder, and I've never seen one of you come in here before. He goes, can you tell me which ones would be good? I was like, oh, this is like my most favorite thing. Yes, you know, I can tell you. So I had him order a bunch of really good books, you know. So whether they got checked out or not, I don't know. But that's also another option. I've mentioned the Medicare Learning Network before. I don't know if I mentioned it just now, but also on Medicare Learning Network, just so you guys know, it covers everything, again, about reimbursement, about, you know, the laws and everything else. So it is a fantastic read. And if you get lost on the CMS website, just directly Google Medicare Learning Network, and you'll be able to see the link that gets you to the landing page. And I've also done that video about how all the websites that I recommend, okay? If I remember, I'll put it in the description box. But I did that not too long ago. But to wrap this one up, I will say this, because I talked about ungratefulness, right? There's a lot of people that are commenting lately, oh, well, you need to explain how to code, and you need to do, okay, first of all, when I have done that before in the past, I used to do a thing called Quiz Friday, where I would make up 10 questions, and I would post them, and then I would do Answer Monday, and I would explain, and I would go over everything. Now, I started my channel in 2018. I did this from 2018 to 2019, okay? And steadily, of course, as the channel grew, you know, people would, you know, say, well, you know, it's not up on the screen and I can't see it. I've never, I've never pretended to be one of those ones with flashy, you know, edited videos. None of my videos are edited, none of them. And to date, I have over 31,000 subscribers, and all just me talking and sharing information and doing what I do. Okay. So I've always been very direct about that. I've always talked about the examples. And when I did Quiz Friday, I put them in the description box so that people could look them up and things. And again, I got such horrible, horrible comments and from ungrateful people. But I had a lot of really great feedback from people that were grateful. But again, I say that I can only speak for myself as a content creator here on YouTube, in that I spend my time to do these things. And when I did Quiz Friday, it was a lot of time and energy that went into finding the answers, getting the rationale, so that way I can explain it and do all of those things. And it was a disappointing response to get those kinds of things. So I have to limit those types of times of getting myself into those situations. So that's why I do it all for my Patreons now, because those people are paying to support me. So that's where I can trade a little bit more of my time for those folks, because their pledges help to continue my education, which helps me become a better medical coder and become a better presenter and become a better just overall colleague to my colleagues. And so with that said, I will always continue to share my knowledge. I will always continue to make these videos and do all the things that I've been doing. But at the same time, I will choose what I post about, what I will do examples of or talk about or whatever. I always welcome suggestions and things like that. But don't have an attitude when, you know, you're asking me to do something like that. And then, you know, saying, well, you know, you didn't do this, you didn't do that, when I've done plenty of those videos. And if you look back on those videos, you'll see a lot of them didn't get over 200, didn't get over 300 views. So that's kind of low, especially for videos back then. And I've had views that went into the thousands. So it's not like, you know, oh, that was just a weird anomaly. No, it's specifically on those types of videos. So I don't know. Like I said, I don't know why. I don't know why y'all don't watch them. But for whatever reason, that's not what gets picked up. I mean, it's just not. So, but anyway, that was it. That was my message. But like I said, I love helping y'all. But, you know, just like I said, I have to limit those types of things. So anyway, with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.